Medical staff at the new Roseland Hospital on Chicago's far south side are once again rushing to the front line, stepping up to care for those impacted by a fresh surge in positive COVID-19 cases. But the second spike in Chicago has again exposed the hospital's fragile finances. Roseland is a so-called safety net hospital, providing care to low-income, uninsured and vulnerable populations. For years, the hospital has suffered from a lack of investment.
Budget-wise, financially, a safety net hospital is always in the red. So it's not a matter of, what's the profit margin. It's how you deal with the debt structure. Now, we've taken on a lot more debt. We've taken on a lot of construction projects. We've added a lot more staff. So we are just literally managing our debt on a minute-by-minute basis.
We first visited the hospital in April, in the middle of the first wave of the pandemic. Despite developing an in-house COVID-19 testing program, the hospital did not qualify for any of the $12 billion in federal funds aimed at helping hospitals survive the pandemic, as it hadn't met one of the criteria, admitting 100 COVID-19 patients by April 10th. Roseland Hospital is situated in one of Chicago's poorest neighborhoods. Years of disinvestment have led to high unemployment and crime rates, while much of the area is considered to be a food desert.
You know, it's sad when your zip code determines your health outcome and not your genetic code. It's been proven time and time again that communities like Roseland have been underfunded and resources have not been shifted to the front lines that we deserve here in an underserved, divested-in community.
In April, Chicago's huge conference facility McCormick Place was transformed into a field hospital to cope with the initial spike of COVID-19 patients. In the end, just 38 patients received care there, at an estimated cost of $1.7 million a patient. There are currently no plans to do the same this time round. Roseland has the capacity to expand to cope with the new surge, but that will need further funding and resources. Roseland Hospital, along with many other so-called safety net hospitals, was already struggling financially even before the COVID-19 pandemic hit. The coronavirus has only brought further strain, and Roseland administrators say the hospital is now in dire need of more funding. Roseland operates on a $50 million annual budget. Although the hospital has received some extra funding to cope with the pandemic, its CEO says it's not enough to cover the hospital's outlay.
Quite frankly, safety net hospitals don't have enough resources to fight this battle. And my position will always remain strong that we need the federal government, the state government to step in and give us the resources we need to help battle COVID-19.
In the meantime, the staff here continue to focus on the task at hand, battling a new surge of COVID-19 cases. Longer term, despite the pandemic underlining its value to the community, the future of this hospital remains uncertain.